Lost connection. Sorry about that. Lost connection. Had a family member enter the room, which can't blame her. I would like to blame her. Well, I wouldn't like to blame her because it wasn't her fault. So I can't blame her. So, but yeah, sorry about that. I don't know how this is going to work. I guess it'll just post below the other post for the. So hopefully you can just seamlessly run it on, which we're saying areola reductions can always recur. I think I was saying, but it's less likely to occur with a permanent suture, which is what I tend to use. The problem with a permanent suture is, first of all, if you feel the knot of that permanent suture, you're always going to feel the knot of the permanent suture. Obviously, if you use a dissolvable suture, then this knot dissolves. But so I always try and hide the knot. I try and bury the knot at the 6 o'clock position, and I try and put it deep so you don't feel it. But that is a risk. It's like anything. You can say, well, if it's permanent suture is good, why doesn't everyone use it? So, you know, that's why, because you can feel the knot. The other thing is actually you've got to use a clear permanent suture. It's quite rare to get a clear permanent suture. Most permanent sutures have got colour to them. They're black or they're blue, simply because they're permanent. They normally need to be taken out. So, but we've got those. 2, 3. Number 3 is permanent suture. If the knot gives way, obviously the areola reduction, the areola enlargement will recur. So you can still get recurrence even if you use a permanent suture. So if the knot loosens, then it can recur. So it's not 100%, but that's something you could consider, is having it done with a permanent suture, not given those risks I mentioned above. Also, inverted nipple sutures dissolve. This is a question from one of my patients, I think. What happens with the dissolvable sutures with an inverted nipple correction? So yes, they are yes, they are dissolvable sutures, and yes, you can usually see them on the skin. Usually, when we see dissolvable sutures on the skin, they dissolve quite quickly because we don't want to give stitch marks, and so usually they dissolve within about a week or so. Most dissolvable sutures we use on the skin. Inverted nipple's different, and the reason inverted nipple's different is because I need to get some tissue and some scarring underneath the nipple to hold the nipple up, and therefore I use a much longer term dissolvable suture. So when you get dissolvable sutures, you can choose. There are different types of dissolvable sutures which take different lengths of time to dissolve. So the ones that I use for inverted nipple take a long time to dissolve. By that's like a couple of months, because I want to get scar tissue underneath, and also because they are actually on the nipple themselves. And if you get stitch marks on the nipple itself, it doesn't matter. Little red marks on the stitch, you can't see them. You never see them. It's not a problem. It's not the same as having little red marks on your skin. If you see the classic scar, like someone who's had, like, a pirate scar, or a laparotomy in the tummy, you have a line with dots on either side. Those are stitch marks, those dots. And so as plastic surgeons, we always try and avoid those stitch marks, which means we either stitch with dissolvable sutures which are underneath the skin, so they've got no stitch marks on the skin, or if you're going to put stitches on the skin, then they either come out quickly or they fall out quickly if they're dissolvable. So, but it doesn't matter in the nipple, because stitch marks don't matter on the nipple or the areola, because you can't see them because it's red anyway. So that's it. That's all my question. I thought I had loads. I to talk about today. That's it. Areola reduction, inverted nipples, 2 tattoos. So, as I say, look, if you had a question and you couldn't get it in this week, don't panic. Just ask on Facebook or on Twitter or email us, and you can get it in next week. Obviously, we've had some international inquiries this week, so obviously that's been, that's obviously swelled the questions. But I'm sorry if you're disappointed. Thank you. Have I answered your question then, Amy? Were you one of those questions? We had 2 Amy's. Right. Well, you're welcome. Oh, yes, you got a question. So Amy has asked, one of the Amy's, 2 Amy's in. It's an Amy night, so it's an international Amy night. Amy's only tonight. So if you're Amy, please ask a question, or post a comment. Anyone? So Amy 2 is going abroad for arm reduction. Yeah, email Laura. Well, you can ask now, Amy Kate. You can ask now if you want, or you can email Laura at sternoplasticsurgery.co.uk. But Amy Core is thinking of going abroad for arm surgery. What should I research? Okay, nice question. Okay, now I can understand why people go abroad for surgery. It's nice to go abroad, and you can sort of think you're having a bit of holiday and things like that. And also, there's obviously cost implications. What I would say is the sort of things you want to look at is ideally, if you know someone who has been there, you cannot beat personal recommendations. So if you know someone who's been there, that's the best, and they've had a good treatment and they've been treated before and after the surgery well. Second best would be to speak to someone that the clinic can put you in touch with who's had it done, maybe someone from the UK who's been out there and had it done. That would be second best, to speak to a real person who's actually been out there. The things you want to look out for is, number one, you want to look out for the training of the surgeon. The problem is, if you see my book, I've got my book, Never Accept a Lift from Strangers. I talk a little bit about this, about going abroad for surgery. It's variable, the training of surgeons in the world, and so you've got to look at the training of your surgeon, because different surgeons in different countries are trained to different levels. So that is a bit of an issue that you can't, you want to be sure that your surgeon is fully trained and insured. One of the reasons you've got to think, well, why is it so expensive when you go to, I don't know where, Prague or somewhere. So why is it so cheap when you go to wherever it is, or Eastern Europe or Cuba or whatever, it's cheap in those places, and why is it so expensive here? Well, one of the reasons it's so expensive here is because we have to pay a lot in insurance, which means we are covered if there's a problem. Then we're covered with insurance, so you will be compensated significantly, rather than the surgeon saying, "Oh, I haven't got any money, I can't pay you." So we have to pay quite heavy insurance premiums in this country. So look at the insurance premiums of the clinic stroke the surgeon, look at the training of the surgeon. And the other thing that I think is absolutely vital is what facilities have they got in the UK? Because the problem will be that, what if you have a problem in a week or 2 weeks, or I don't know, when you come home, basically, if you're not happy with things, if you get a problem with a scar, problem with a wound, infection, etc., is there someone you can go to? Is there a place you can go to? And ideally you want 24-hour, because you don't know when problems can occur. So you want 24-hour access, really, to a doctor. The private hospital. So wherever you live, Amy, there is going to be a private hospital near where you live, and there'll be plastic surgeons working at that private hospital. And if you have if you have surgery there and you have a problem at 10 o'clock at Sunday night, on the bank holiday Easter weekend, you will be able to ring that hospital, speak to the nurse will speak to the doctor. There'll be a doctor on site in the hospital, and that doctor will be able to contact your surgeon, and you will be able to get an answer, and if necessary get seen, and if necessary go back to the hospital and have surgery that night. I mean, probably won't need, you probably won't get problems, but that is the thing about going locally. I always say go locally, because if you have a problem, then you get seen straight away, and you can get advice or having other surgery. So if you haven't got that, if the hospital's in Prague or wherever it is, then how can you get access to advice out of hours? And the other thing you've got to think about, if you did need some kind of revision surgery, arm reduction, you can have dog ears, problem with the scar and things. What do? Do you have to go back out to Prague to have it done? Is there any way you can have it done here? That's the other thing. So the revision policy, if you have problems, and also the problem if you have a complication in the first week or two, how do you get it sorted? Because the fact of the matter is, I can see, Amy, you've got a question here, so I'm going to answer that about VIP, and I will answer that. The fact of the matter is, a lot of people go abroad for surgery, come back, have a problem, and end up in A&E. That's and then the NHS have to look after them and treat their issues, because there's no backup in the UK. But that's something I would look into if you're thinking going abroad. And I've got to say, it's not something I advise. As I said earlier, I do not advise people to go abroad for surgery. I think you're much better off having it at home, local surgeon, you know what the training is, you know the standard. Look for someone who is or has been an NHS consultant. You know they're going to be fully trained, and they will look after you. And again, same thing about the word of mouth thing. So good luck with that, whatever you choose to do. But think carefully about going abroad. And if I understand a lot of people do it, so we can't lose sight of the fact that it's a very common thing to do. But that's that. So Amy Kate said, do you also work at VIP Cosmetic? I want a consultation with yourself, but wasn't sure where to go. I messaged on the Facebook Live last week as I've breastfed for 20 months and stopped. Hold on a minute. Stopped the start December. You're very welcome, Amy. Good luck. That's Amy Core. You're very welcome. Good luck with that. Let me know if you need any more info, and if you go for it, then good luck, and I hope you have a good experience. But Amy Kate, sorry, I've got to click more. I've breastfed for 20 months and stopped the start December. Don't feel like there's any other. So I needed to wait a few months for a consultation, but don't want to go to a big company like Maya, as I want a good aftercare with a smaller company that's local to me. Sorry for a long message. Thank you in advance. No problem for that long message. Excellent. No, I don't work at VIP Cosmetic. VIP Cosmetic Surgery was me, Guy Stern, and Mahbub Ali. It was basically the three of us. So we got together and we just put our everything together in one sort of package. I know that I'm still on all the website and everything and all that thing. But what happened was I then went full-time private. We all had NHS practices and we did a bit of private work. I then went full-time private. So I was sort of building my practice a bit more than the others. And so I left them. I think Guy's now gone full-time private. I don't know what's happened with VIP Cosmetics. So I don't know if it's still happening. But basically I don't work with those two guys. We still meet often and talk about cases and things, but we don't work together. So if you want a consultation with me, then you can get through me through Facebook. You can give me a ring. There'll be a phone number on the Facebook page. Is there? There should be. Just give my clinic a ring. I've got a clinic in Edgbaston. I also work at Priory and Parkway Hospitals in Birmingham. So be very happy to see you. You breastfed for 20 months and stopped the start December. Don't feel it's going. So needed to wait a few months. That's right. So you stopped it in December. So that's right. You have to wait a few months to settle. And I'll be very happy to see you. And I think I said last week, just you can always come and see me any time. We can talk about it. It's good to wait a while for things to settle down. No, you don't. That's the point. So Amy, good point. Nice one, Denise. That is a real person. Denise is a real person. I can assure you, it's not my wife who's in the next room. I think. Thanks, Denise. Excellent. I should have thumbs up more, but I'm definitely thumbsing that one up. So no, you don't have to pay for a second consultation. So that's the beauty of it, Amy. You can come and see me. We can talk about it. If you need surgery, or if we say you're going to have surgery in 6 months or a year or whatever, then you can come back. So I never charge for follow-up appointments. That's before or after surgery. So if you have any problems, so if you have any questions afterwards, or if we say let's do it in 6 months, you come back in 6 months and we do another consultation, or we just similarly, if you have questions, you can come back as often as you want prior to having surgery. Same after surgery. If you have any questions or anything, I never charge for follow-ups. I encourage people to come back to have a chat and see how you're getting on. So yeah, come and see me anytime. But if you finish breastfeeding in December, then yeah, about now will be good, because sometimes see people about 3 months. Plan it for another 3 months. I'd say wait at least 6 months after breastfeeding. Ideally up to a year, but at least 6 months, depending on your schedule and your life. But we'd be very. We could just go through it, so that's fine. Yeah, anytime. Anytime's good with me. And that's good. That was a saviour. The two Amy's stepped in. Denise has been coming to see me for years, and you can come and see me anytime. To be honest with you, I'll tell you the problem I have is getting people to come back and see me, because I say to everyone, come back. Everybody I offer, once we've finished after the 3-6 monthly thing, I offer a yearly appointment. And the difficulty I have is getting people to come back, because I want to see how you're getting on. I want to see how my results are. So yeah, I always encourage people to come back for follow-ups. And when I go, I did some teaching this weekend, just gone in Olympia in London, the UCARPS meeting. That was good at the. And I say to the guys there, I do not discharge my patients. I never discharge anyone. They have to discharge themselves. They have to say stop coming. I always say to people, come back and see me year on year. I want to see how my results are. I want to see how it all is going, and that's the way I run my practice. So yeah, Boom, that was good. That was the two Amy's stepped in there and salvaged that one. I'm going to check out if that's okay with you guys. I'm checking out email questions. We've had a plethora, international and domestic questions this week. Same time next week, 7 o'clock Tuesday, and we will do it all again. Thank you very much for not only asking questions beforehand, but also for stepping in on the day. And so that's twice you've done that, Amy. You've done that last week and this week, so that's great. And the other Amy was a once. And good luck in your overseas surgery, Amy 1 or Amy 2, whichever Amy it was. And dramatic pause. Any more questions? No. Okay, so I'm going to check. Well, if you are asking questions, I've had this before. People ask questions, and I've stopped it. I'm not doing it deliberately. I'm not seeing any more questions, so I'm going to check myself out. And looking forward to do this next week. And yeah, I've been up and down the M6 all day today, so I'm going to go and have a lie down now. And see you next week. Check out.